Yeah.
How old should you be to start using fillers and injections?
I would tell you, I would not do this as a kid, but what I would tell you, it's usually something, it's very age dependent and it's in genetics. And we start seeing it with the, more and more I see younger people in their mid-20s, early 30s when we start seeing some of these areas in the areas in the forehead, the crow's feet, see them in some of the younger patients. I see this on younger patients who have problems with deficit in their lip. It's not rejuvenation, it's more that they want to enhance the appearance of their lips. That's when we start seeing maybe in the mid-20s, but you know, early 20s for this maybe. And then late 20s, early 30s would be the time when I would be using fillers. Yeah.
It's interesting. Now, how many treatments does it take, or is it, or every procedure is different as to once every 6 months, or maybe twice a year?
So one of the things, so that's a great question. So depending on which filler you're using, it depends on the durability of the filler. Some of these fillers, initially, one of the things that will happen with them is especially the absorbable ones will last between 6 months to a year, and they start degrading little by little or slowly. Okay. So the effects might still be noticeable for a year. So usually what I tell my patients with filler is that they'll come in for a touch-up every 8 months to a year or so. For fillers. And then the Botox, depending on how many times they use it, most of my patients usually will do it initially on a yearly basis, and eventually you start developing a little bit of resistance, and then sometimes what they'll do is they'll come in every 6-8 months or so for the touch-ups.
Now, who's
the good thing about it is that, Kathy, I'm sorry to interrupt, the good thing about it is that there's no time down for this thing. So the patients can, you know, literally have this in lunchtime and go back to work, and there's really no downtime for these interventions.